Hello, everyone. I'm Donna Meltzer, CEO of the National Association of Councils on Developmental Disabilities, NACDD. I'm so excited to be with you here today and to bring to you our guest, Raquel Quezada. Raquel is very familiar with NACDD, and I hope familiar to some of you, as you may follow her or have heard her speak at one of our national conferences. Raquel is also a member and secretary of the Massachusetts Developmental Disabilities Council, amongst many other things that Raquel does in her life that I'm going to ask her to share a little bit about with you today. So let's begin, Raquel. Thank you so much for taking some time out of your crazy busy day to join us at NACDD. How are you doing today?
I'm doing well. Thank you so much. The honor is mine. Thank you for inviting me to this particular and very conversation that we're going to have to raise awareness about COVID in our family and all over, you know, not only the Latino community, every community. So thank you so much.
Oh, thank you. And thanks for letting our audience know what our big topic is today. Of course, it is about how we've all been doing during COVID-19, this pandemic that is still very much with us. And of course, we're talking about vaccine today. But before we get into all of those specifics, tell us a little bit about yourself and this variety of things you do. I know you are a woman who's a chief executive. You are a founder of an organization. You are an author of 3 books. You're a mother. You're a wife. You do all kinds of things. So tell us a little bit more about your work and your commitments and what you've been up to over the last year or so.
Well, for those who doesn't know me, if you see my decks, you're going to see like I have different hat that I just take one thing, doing another one. I was, writing the name of the people to give her the Christmas present and for our organization. And then all of a sudden I had to grab my computer to do my homework because I'm a study psychology. And then all of a sudden I had to run to the kitchen to cook. This is my life and I love it and I enjoy it. I'm doing everything that I do with passion because I'm follow my purpose in life. And I believe that having a son with disability is what take me to all the stuff that I'm doing. You know, I'm part of the Massachusetts Developmental Disability Council, but I'm also, like you say, I wrote 3 books and my 4 is already submitted. And I'm happy to do all the stuff that I do, to work with my community, to have in my radio and / TV program that I educate so many family and, given the resource and bring some topic. They are very valuable for our community. So thank you so much for having me here today.
So let me make sure I get this right. You are a student. You are doing volunteer work with the Massachusetts DD Council. You have a radio show, a TV show, and you are the mom of a son with a developmental disability, right?
Yes. I also clean, cook, and take care of my house and my husband too.
Of course, you just are a superwoman doing it all. We commend you for that. So is it your son who has really inspired you to become involved in the developmental disabilities community?
Definitely. When my son born, he come with the diagnosis of cerebral palsy and other, another medical complex. And the need that I had when he's born, I was, resembling with so many mother and parents in my community that whatever happened to me, I believe it's happened to them too. So my son is a big inspiration for everything that I do because when I see myself taking care of him, I see so many parents, so many mother that they are struggling every day. So yes, he's my inspiration. He's, the trigger, whatever I do here, but also to, not only to think about him, I do it to, to share my knowledge and my experience with so many parents in my community, and a lot of community too.
Yeah, thank you so much for that. And I think, what you are doing, bringing forward your leadership as a Hispanic woman is really making a huge difference. We know in our country that there are many communities of people who have not fully engaged, I'm talking about people who are either people who have an intellectual or developmental disability or are a family member of, a parent or maybe a sibling, or even the child of, but their cultural background and perhaps ways that they have operated within their own families did not necessarily help them to feel comfortable talking about some of these issues. Tell me a little bit about how you've used your platform through your radio show and your television show to really help more people in the Hispanic and Latinx communities feel comfortable talking about IDD and becoming more involved parents, family members. I know it's always difficult to get involved as a parent in the school system, advocating for your child and their needs. Tell me a little bit more about your work in that space and what you feel you have achieved to help other families like yours.
As I say in the beginning, I struggle. I struggle so much to get resource available in my language. And, seeing my background as a communication, in my country, I used to work on radio and TV, and then here me in United States with, a child with disability, just come to my mind that why I don't create a platform, social radio show. Now it's TV show that people can see in Spain and in so many, places in United States. And then I say, let me start with the small, production, 1 hour, and all of the so now we do 2 hours. And it's just, just to share knowledge with so many professionals, so many parents that they want to come and talk about experience, but also, to give the opportunity to people with disability to share their experience, but also to be part of the program. So I have so many collaboration professional people with disability all over the world that they come and talk about, their own experience, but also, to share knowledge so people can open their mind and their eye, to different world. When people with disability struggle and have, different experience and barriers that they have, all over the world. So I feel happy. I think, one of my dreams is, as a Martin Luther King have a dream one day, one of my dreams is that every state, every community have, they have, just a program. They share knowledge that doesn't have to be on radio, doesn't have to be on TV. Even, the internet, the platform now and the internet, Facebook, Instagram, anybody can do this. I just want to, encourage, for you as a parent, as a professional, just create a platform where people can identify themselves and they can find, that they're not alone.
Yeah, I recall the last time we spoke a couple of months ago, you had even indicated to me that, originally your platform was mostly here in the United States, but that one of the, let's call it a silver lining of the pandemic, was that you are now speaking to an audience of people around the world. What is that like? What differences do you see perhaps of how people are managing here in the United States versus some other countries?
Well, coming from, Dominican Republic, I always feel the need to, always to be an example, not only for my country, but for different countries. So people start calling me, hey, can we share your program as a collaboration? And I say, yeah, why not? I mean, I'm here for that, This is not a business. This is not a work that I do to get, rich. This is a business where this is a program that I can share with my community and I do as a leader. So if anyone that listen to me right now want to share my, information in my program, that is not mine, you can do it. So people start calling me from Venezuela, Guatemala, Dominican Republic, Spain, and they very interested in share my, the information that I've been putting over there. And it was fascinating. I mean, I've been having phone calls from people from Mexico, Colombia, that they are identified themselves as the parents, with me. But also, I've been connected with so many collaborated people from all over the world and professional that they want to just put, a little bit of rock to create a better world for, for everyone, not only for the people that have disability, but for those who doesn't know what is to have a child with disability, because changing the world for people with disability is God changing for those who doesn't know what it mean to have a child with disability. So they can, when they see in the street, when they see in the community, they think and say, well, I know how to reconcile struggle with the child with disability. Let me put a more empathy. Let me put a more love. Let me put a, more acceptance in and create better work for them. So it's been amazing 4 years. I mean, like in 3 months, we're gonna have 4 years in the air. And like I say, I'm just like, a servant of God, that I doing this because it's passionate me so much that I just want to do this for the rest of my life.
Well, we certainly hope you will be doing this for the rest of your life, because we need you. And that's just great that you are dedicating so much of your time and energy to doing this really important work. Families need support, families need help, and families need good, solid information. Tell me a little bit with respect to COVID-19 and the vaccines that have now been available since late last winter, early springtime. What kind of information do you feel that people in your community are getting, and how are they feeling about the information they have? I know, particularly at the beginning of the pandemic, and as we were starting to first talk about getting a vaccine, there was a lot of hesitancy. Where do you see your community now that the vaccine has been around for quite a number of months, about 6 months or so, depending on whether you were one of the first people in line or a later part, the average being about 6 months? How do you think your community feels about the vaccine at this point?
Well, I have to start by saying that this pandemic been hitting everybody very, very hard. But for the Latino community, it's been way, way hard because people, been struggling with economy, mental health, lack of information they coming in their language. But as long, we've been progress and have more information and the time go by, they've been being more like, awareness that we had to get vaccine. That this is important for not only for parents to get vaccine, but also to get vaccine their kids. As myself, I've been vaccinated, my husband and my son, who is 16 and has cerebral palsy. Why? Because, it's very valuable. It's very important, not only for us to protect ourselves as a parent, but also to vaccine to those who we love, and the way we show love is to getting vaccine. I can wait for the vaccine to be ready for my child, for my other children, that they are 7 and 11, because this is, one way to protect ourselves. And, our community now having more information in the language that they can, accept and create more awareness that this is important. So we working, we've been progress, and my hope is, that everyone in my community, as a Latino community, they get a vaccine, and to understand that, it's now, this is a time for us to protect ourselves, but we don't have to wait for be an emergency room with, oxygen in our face because we don't get vaccine or our kids don't get vaccine. So, I just encourage everyone to get vaccine because this is very important, not only for our family, for everyone all over the world.
When you and your husband were making important decisions, especially for your son with CP, and I think you just mentioned that he is 16, so recently he became of age to get the vaccine. What questions did you ask yourselves, or maybe of the doctors who are close to your son? Like, were there important things that you had to think about? I know some parents who have children with disabilities have a lot of questions for their doctors. They really want to be sure. All parents want to be sure that this vaccine is safe for their children, but I think perhaps even more so for a child who has a developmental disability. what thoughts went through your mind? What questions were on your mind? Did you work with your son's doctors? Tell us a little bit about your family's process that you went through.
You know, working in this field, there's so many information that come into your hand, into your ear. And I was trying always to focus on the positive, not to, you know, hear my neighbor or not to ask a friend that they don't have any resource available. So I was trying to educate myself, you know, and also work with the doctors, because my son has so many doctors, you know, and get so many questions in every, you know, field that I need that information. So, you know, every doctor was like positive and say, you know, yes, we had to do it. This is a value. This is, you know, to prevent. And, you know, I did my own research and I was trying to educate myself as long as my husband too. So I think that I'm pretty sure that we take the best decision that was, you know, to get a vaccine, my son, and, you know, to pass it on to my friends and, you know, and I was like trying to be the inform for them also too. And they was like, okay, Raquel, you did it. I trust you, you know, because you being in our community and you being show ourselves, you know, that we had to be educated, that we had to also had to have our own resource. And they like, oh, you are my resource. So if you did it, let me do it. So that was a very valuable for me. That was a very valuable for my family to see that we sitting in a sample for my community and for them to trust us. That was great.
Mm-hmm. That's really key. You know, we did a little survey of individuals in the disability community earlier on in pandemic about asking people, you know, what would give them comfort? Who were their resources? Who were they turning to? And it's exactly what you just said. People said it's not so much that they want to hear all the science and all the background. They know that that piece is important, but what they really wanted was to hear from leaders in their own communities, to hear from people who look like them and maybe who speak their language, to really say to them, I did it, it was safe for me, it's protecting me, it's protecting my family, so I feel better about it. So thank you for being that leader and putting yourself out there. I'm curious, what did your son think? You know, as a 16-year-old, he certainly has thoughts of his own and maybe fears of his own. Was he always on board with getting the vaccine, or was he experiencing any hesitancy?
Well, his IQs is very low for him to understand what is going on with the pandemic. You know, what's been happening, why mommy is now too much at home, why my daddy is not working anymore. It was like a roller coaster of emotion, I think, for him in the positive way. We started being together more as a family. For us, we decided to take, you know, the value, what is the pandemic? We're getting, you know, the positive thing that we can get it from the pandemic. But he was like, you know, aware that, you know, something is happening. So before the day that he getting his vaccine, I was trying to tell him, you know, hey, we're gonna go to get your vaccine. Before he had 3 tests prior the vaccine, because in order for him to keep in going to his medical appointment, he had to get a test before he see the doctor. And he don't like that idea. So I was trying to tell him, hey, if you get your vaccine, you're not gonna get a test anymore. You're gonna be fine, and this is gonna be over. So he was pointing like a vaccine. The doctor, he was doing signs because he's nonverbal. He's the sign. So I was trying to educate him. You know, even though his IQ is very low. But the day that we went, he was like very cooperative. He was like, you know, he was actually signing that nurse more. I was like, are you serious? You want more? So he loved it. He enjoyed it because I was preparing him before that day and that time. So I always encourage parents, you know, even though your child doesn't, you think they don't know what are you talking to them, just prepare it, just tell them what is the procedures, what you guys gonna do, and talk about, you know, the pandemic and the vaccine, because, you know, they're gonna get something out of it.
Yeah, absolutely. And similarly, what about your two other children who are soon to be eligible or almost eligible for the vaccine? What are their thoughts? Are they excited? Do they think about, well, if I do this, I'm helping to protect my older brother? Tell me about that piece of your family and that dynamic.
Yeah, they very on board. They very on board. They like, can wait for them to have the vaccine because we still have a lot of restriction, right? Restriction. And some of the activity that we cannot do because they are not vaccine and we want to protect them too. So they can wait. They really know. They've been listening to the news. We've been talking to them about it. What is the benefit, and we just can wait for for the government to say it's okay for them to have the vaccine so they can have it.
Yeah. And are your children back in classrooms and school at this point?
Yes, they in class. They already in class and they wear masks, but they can wait also to take that mask the whole day. I mean, imagine a child 7 having a mask in school the whole day. By the time they get a vaccine, I believe I don't know if they're gonna stop wearing masks or what is gonna be the new procedure, but we just want this to be over. And the only way that this is gonna be over is that everybody get vaccine.
Oh, I couldn't agree more. And that's, exactly why we're having this conversation and really trying to support and help everybody who wants to get the vaccine to feel comfortable getting it, to be able to have that access. I know our DD councils, including Massachusetts, have done so much to really help make sure that that access is there for everybody, whether it's, transportation to get to it, help if they need help making an appointment to get a vaccine, whether it's the original vaccine or now it's a booster or it's for your children. We are, helping people in every which way. Raquel, are we missing anything? Are there other things that you would recommend that we at NACDD or our DD councils really make sure that we are doing to help all people, including people whose native language is Spanish? I know many of us are trying to get more information out in Spanish, as well as in plain language, simple language, so that people with intellectual disabilities really understand everything and know what they need to do. But do you have thoughts or ideas? Are we missing anything that we should be doing?
I think no. I think we've been doing, as a parent, as a professional, I think we've been doing a pretty good job to inform every community. I just have to encourage the professional, like you mentioned, speak in plain language, whereas the family can understand. Don't expecting that always, a family member have a good knowledge about, this topic, and try to bring the information in the language, in the native language that they can speak, so they can get more, bored, and they can get more information, and they can take the decision that they had to make for their family members. Also I can, encourage everybody to use the platform, to use your work space or any space that you think is valued, to go to a group parents or anywhere that you can inform and educate about this topic, because as I said in the beginning, when everybody get vaccine, we can get back to normal. And yes, this is gonna be over, but it's the professional, the government, the school need all help as a parents. And I believe that this is gonna be over, but we all need to be vaccinated.
Thank you. Yes, so true. And I appreciate your comments about making sure that we do use plain language, that when people go for their vaccine or to any visit really with their medical professionals or with teachers in the school setting, pediatricians, wherever they're going to either get the vaccine or have conversations, that we make sure everybody is fully understanding. I did want to ask one follow-up question about your son's experience when he got the vaccine. Were there any issues that he had around, sensitivity? We know some people with their disability, need to be in a quieter space, may have their own questions they need to ask, or we want to make sure that everybody who is giving the vaccine, whether it's a doctor, a nurse, everybody who's involved really understands the needs of people with IDD. For some people, they really get very anxious, may really dislike needles, may even be very afraid of needles. What advice do you have on that? Like, what was your son's experience, and what other advice, or are you hearing things from other parents where that is maybe their big concern, is making sure that their child will feel comfortable when they go get the vaccine?
This is a very value question that you asked me, because one of my concerns was that my son have a seizures episode. And one of my worry was about, what about he has seizures in the middle of the, vaccine or after. But he was reacting very well. I was very surprised. The only thing that he had was a mild fever. And then in the second one, he had the same, a mild fever. I leave him home. I don't send that the next day to school. And it was fine. He was like very recovered. His health, continued to be normal. Nothing affecting him after. And, I've been receiving a lot of, the same thing from another parents, that they say, okay, I did it, they fine, they're reacting fine, and we're speaking a lot of people with different medical complex. So yeah, and I'm a woman of faith. I always put positive and put my, everything that I do in God's hand, and I always, say, God, if this is your will, it will happen. So, always, be positive. Don't always call the negative thing to your life, because if you call the negative thing and say, oh no, he's going to get sick, something bad's going to happen, that's going to happen. So, be positive, and make the decision. It's nothing wrong to trust professional, to trust the system, and, just to have faith,
Love that. Could not say that any better, Raquel. Yes, you have to trust science, trust in God, trust in yourself, do the right thing, help other people. God helps those who help themselves, right? Isn't that a well-known statement? We do want people to do the right thing, whether it's for themselves or for others, so that we can all be a community and all go back to whatever that new normal is going to be. But we certainly want to see everybody's kids, like your kids, to be back in school. We want parents to be able to get back to work and to doing all the things that we as people love to do, whether it's going out to dinner or to a baseball game or to the theater, to travel. And vaccine is really what's standing between where we are now and our ability to safely do those things into the future. So I really appreciate your sharing your personal experiences, your family's experience. I trust you're going to continue all of this great work in your radio program. How can people find you if they want to listen to you on your radio program or your television program?
Sure. We are transmitted in our YouTube channel, Cambiando el Mundo. Hopefully you put it, you put it over there in Spanish, Cambiando el Mundo de Personas con Discapacidades. The same channel on Facebook and in Instagram at Cambiando el Mundo 04. And we are, in disability channel in Spain, in different, radio station and TV channel also in Miami. So I'm going to put the link, or you guys going to put the link, and hopefully you guys can follow me and see the work that we're doing here in Massachusetts. I'm very honored and happy to be part of the Massachusetts Developmental Disability Council here, and just to be, a leader in people that they are, doing our job with passion, and if you as a parent want to do the same thing in your state, you welcome. We are always looking for parents, for leaders, for, people that want to be part of the, the DDC and being born in our community. We always looking for parents like you that want to empower other parents. And if I can do it, you can do it too. That's my message. And I always believe that, always is a leader in every community. Just you have to trust yourself.
Right. Thank you again for sharing that. You lift me up. You are very inspiring. You're right. Anybody can do this, right? And you can be a leader. And I really thank you again for serving on your DD Council, which does such amazing work. All of our DD Councils do. We have been united over these last 18, 19 months in solving this current pandemic crisis, but really looking at so many more issues as well. Helping all families who have somebody in their family with an IDD who simply wants to live their best life in the community. So there's a million ways to get involved, whether we are supporting healthcare, employment opportunities, looking for better housing options, transportation, so many issues that are important that really help people to be able to fully access community. So we're grateful for you being involved and for you to speak to others and help them to get involved.
One last message to my Latino community. Don't worry about if you speak with accent. Don't worry about if you speak maybe not perfect English. The message need to be delivery. And the only way that we can change the system for behalf of our community or behalf of our family is if you stay in the table. You are, opinion is valuable. You need to be in the table. You need to be here. So, like I say, believe in yourself, believe in your community, that we all can make a change.
Full stop there, Raquel. I have nothing else to add to that perfect statement. Thank you again for giving us your time today, for joining us and for sharing your messages with our broad community, with your fellow Hispanic, Latino communities. We want everybody to know, I love what you just said about don't worry about language. Getting good healthcare supersedes any language, right? Go see your doctor, go get vaccinated, take care of your families and your children. Let's get our country healthy again and back to doing all the things that we love. Raquel, we love you. Thank you for all that you do. And again, for joining us today. We look forward to talking with you again soon.
Thank you.